From Bowling Green State University and the Institute for the Study of Culture and Society, this is BG Ideas.
I'm going to show you this with a wonderful experiment.
You're listening to the Big Ideas podcast, a collaboration between the Institute for the Study of Culture and Society and the School of Media and Communication at Bowling Green State University. I'm Jolie Sheffer, professor of English and American Culture Studies and the director of ICS. As always, the opinions expressed on this podcast are those of the individuals involved and do not necessarily represent those of BGSU or its employees. Bowling Green State University and its campuses are situated in the Great Black Swamp in the lower Great Lakes region. This land is the homeland of the Wyandot, Kickapoo, Miami, Potawatomi, Odawa, and multiple other indigenous tribal nations, present and past, who were forcibly removed to and from the area. We recognize these historical and contemporary ties in our efforts toward decolonizing history, and we thank the indigenous individuals and communities who've been living and working on this land from time immemorial. This season of Big Ideas focuses on sustainability and sustainable practices. Today's episode considers how to create sustainable, equitable responses to public health issues in and out of periods of crisis. I'm very pleased to be joined by Dr. Amy Acton and Jim Watkins. Amy served as the director of the Ohio Department of Health from 2019 to 2020, the first woman physician appointed to the position. She led the state's coronavirus response in the first year of the pandemic. Amy earned her medical degree from Northeastern Ohio University's College of Medicine, now known as the Northeast Ohio Medical College, and completed her residency in pediatrics and preventive medicine. She earned a master's in public health from The Ohio State University, where she's also taught as an associate professor of public health. Jim Watkins is the health commissioner at the Williams County Health Department and an adjunct professor of allied and public health at BGSU. Previously, he served at the Williams County Health Department as an environmental health specialist and later as director of environmental health. Jim earned a master's in public health from the Northwest Consortium for Public Health, a joint effort of BGSU and the University of Toledo. Thank you both for being with me today. You have long histories, each of you, of working in and for public health. How did you get interested in this field? What was your particular pathway to this? Amy?
Thank you. It's wonderful to be here with you today. And like many in the field of public health, I stumbled into it. You know, a lot of folks know my background. Had a sort of rough childhood, but I had this goal of going to medical school and did go, as you said, right here in Ohio. But it was a 6-year BSMD program. And in medical school, I remember there was this one day, it was like 1984, hearing that the World Health Organization had made a definition for health. And I'd never thought of that, but most of medical school is learning about sick care, not health care. And the health definition was a complete state of social, emotional, and physical well-being, not merely the absence of disease. And I just remember that really got to me. Didn't think much of it. Went to residency in the Bronx at Albert Einstein in 1990. Unbeknownst to me, it was the middle of the crack cocaine epidemic, so we had not quite seen it here in Ohio. The devastation was profound. Half of the children in my practice would be dead by the age of 3 from contracting AIDS in utero. So even though I'd seen a lot as a kid growing up, I'd just not seen suffering on this scale. That really formed a change in me that I wanted to get out ahead of things before they were broken, and stumbled into some folks from the field of public health, ultimately did a residency in that. And so for me, public health is really about creating the conditions in which we can all live healthy lives. And I'd be glad to talk more about that, but I'd love to hear what my colleague Jim thinks.
Yeah. What about you, Jim? How did you end up in public health?
As Dr. Acton said, I was the same kind of thing. I had no idea and stumbled into this field and found it very interesting from the standpoint of the improvement of health that can be done, ahead of, as she says, disease. And I think that we don't accept that as well as we should as a society or understand that. And so the ability to maybe make change in the community was important to me. And I think my history, my parents, we went to Navajo reservations out in Arizona. My parents always used to take us down to southeastern Kentucky. and saw how people were living and knew that things could be better, I think. So I would credit that background interested me and appealed to me that this is something I wanted to do.
We know that the pandemic has made the work of public health officials both more visible and so much more difficult, right, than ever before. And Amy, listeners may recognize you as the face of Ohio's initial response to the pandemic, but you also served as director of the Ohio Department of Public Health prior to COVID-19. What was the work like before the pandemic? How, going into that, how were you thinking about your role in relationship to public policy and lawmakers?
So I have to share with people, this wasn't a job I was looking for. I was very busy working at the Columbus Foundation on youth homelessness. And unbeknownst to me, I was in the presence of one of the governor's closest advisors for about an hour's time. So an hour's time meeting someone. And then one day I got a very strange and unexpected call that the governor would like to see you and meet with you. And so I'd never been in politics, have been in public health for over 30 years. And when I met with him, I was amazed to learn that he had lost a daughter in a car accident right after she had graduated from college. In his grief, he was a U.S. Senator at the time, and the Senate was in Haiti. He actually started building schools with a priest, Father Tom Hagen. And there he met Paul Farmer, Dr. Paul Farmer, who just passed recently, as we know, one of my heroes who I always taught about in my classes, really one of the leaders of global health worldwide. And he went to Paul Farmer and said, I realize that Ohio has some of the worst health outcomes in the nation. What do I look for in this position? And so he meant it. And I can tell you that public health is usually not at the top of everyone's agenda. And when I swore in, I felt like the Ted Lasso of politics. Like I just walked into that state house. I didn't know anyone. I didn't know how it all works. My very first testimony was to fight for our budget. We ended up having one of the largest budgets ever. And so they gave you a script, and the script had a bunch of numbers on it with like a million zeros, and you just read the script, which was the beginning of my going off script, I should say. And I realized nobody was looking up. They don't even know what public health is. So I went into my public health 101 spiel. I went totally off script, and I said, well, I actually feel like I have 11.7 million patients. And did you know that, we live on average 30 years longer over the last century? So when my grandfather was born in 1900, he was expected to live to 48. And that was true for all of human history. That was long life. So Thoreau lived to be 48 years old and did all that amazing work. Well, my grandfather lived to be 84. So where did all that life expectancy come from? It turns out that only 5 of those 30 years comes from everything I learned in medical school, the really expensive fixing broken things, which we want and we need when things go wrong. But 25 of those years are due to things that we can only solve collectively. So it started out with clean water supply, safe food, child labor laws, mandatory education, traffic lights. If you're in other countries, you recognize how important that is. And so all of these things have added to our lives. And the sad thing in Ohio is that for the first time, we're going in the opposite direction. Well, now they're all paying attention. And so that began a really amazing relationship with the legislature where we actually passed Tobacco 21 in the state, lots of rules, first time ever housing as a health issue, money for youth homelessness. We did PFAS in the water, lead safety, a nuclear uranium enrichment leak in Piketon, Ohio, Legionella outbreaks, mosquito prevention. We are the western frontier for rabies, where we drop, who knows this, pellets from airplanes to keep rabies out of raccoons. We did a huge opiate settlement where we got everyone to agree to set aside, every county, 55% of the settlement in perpetuity in an endowment to treat addiction, because we had no money at the beginning. So there's so many wonderful things happening before there was a strange pneumonia.
Jim, you've been Williams County Health Commissioner for many years, and in the past, you've described the role of the health department as health strategists for the local community, with the goal of promoting safety and advancing community health improvement goals. Before the pandemic, what was part of your work portfolio? What were some of your priorities on the day-to-day? And how did you think of your relationship to public policymakers and the public at that time?
Well, I think at that time it had evolved quite a bit to understanding we needed to be more engaged with public policy folks locally, which was a good change for us. We were really looking at that time with health equity issues. We were doing a lot of trying to, first of all, get education to the community, get them to understand what was going on in their community. We had some staff that put together a really nice report that showed differences in life expectancy, as Dr. Acton's explaining there, that in a small town of Bryan, Ohio, population 8,000, we had nearly 10 years worth of difference between people on the east side of this community versus the west side. And so why is that occurring? And so we were starting to get the community to try and understand that, as Dr. Acton has explained, the hospital, the medical community is just as available to those people on the east side. So what's going on here? Why is this occurring? And starting to have that conversation and really trying to move our thought process forward. I think too often people just assume that it's people's choices, and health equity is not about choices. And we have to get people moved in that direction. So we were in an exciting time, and honestly, we were very excited to have Dr. Acton leading the charge down in Columbus. It was a fresh approach. We felt like we had the backing on these types of things to where we would be able to move forward. So we were very excited, very motivated, and really moving forward on some things at that point.
And obviously, in March 2020, everything changed. Certainly, the scope of your jobs shifted dramatically. I'd love for you to walk us back to March 2020, to those early days, as states were scrambling to determine how to respond to this emerging coronavirus pandemic. There's been a lot of attention to national leaders like Anthony Fauci, but you as state and local officials are really kind of on the ground, right? It's very different than sort of setting policy. It's sort of like, you get the pushback very directly and the questions. For each of you, what were your top priorities with regard to making public health decisions and communicating those in those very early days when we knew so little about the virus?
Well, in the beginning, I remember hearing that first report. It was like the last day of December, and it was an epidemiologist from the World Health Organization. And it just caught my ear because her voice just had a little bit of a quiver in it. And of course, we're used to monitoring threats of infectious diseases all over the world and certainly in the state. We learned very early on, we had high suspicion watching how it was spreading around the world. We had patients, on some of those cruise ships, like the Japanese Diamond Princess. There were some cruises out in the Nile, ultimately the boat in California. We had tons of students and faculty who were returning from being gone over the winter break. It turns out, unbeknownst to me, that Wuhan is our sister state. With Ohio, and we do tons of business with the region. And we had just had a contingent come to meet with the lieutenant governor in January. So we were very concerned and decided to get ready early. And I have to say, I couldn't be more proud of Ohio. I had 1,100 employees. We have 113 local health departments, Jim being the commander of one of those. And we started getting together and developing sort of cadences. There is a pandemic playbook. A lot of people don't know this, but right after 9/11, George W. Bush read John Barry's book, The Great Influenza. Had the great honor of talking with him. I'm going to be meeting with him again soon. And he took this to Homeland Security, and they realized that a pandemic, not just a virus, but it is the gravest security risk for a nation. And I can talk more about that, but we've really seen this unfold. So they started a playbook. I had many serendipities during this, but we, with the locals, started getting in a rhythm. We started meeting I think twice a week, and preparing. We did a whole of cabinet sort of tabletop exercise like they do in the military. We had sort of a strange feeling of watching things happen nationally. And I even began to feel like, gosh, I feel like people aren't telling us the whole story. At one point, I actually Googled the word pandemic, even though I had taught Introduction to Global Public Health for years and traveled the world with that, because I just it felt like the playbook wasn't coming into action. One serendipity was that I hired a brand new comms director, communications. Turned out her brother had gone to my medical school here in Ohio. His name's Rajiv Venkaya. And he actually worked in the White House and helped write George W. Bush's playbook. So that helped. She's like, would you like to talk to my brother? And I'm like, absolutely. And so I was able to I felt like in Ohio, we really took it seriously and got ahead. A big turning point, I also represented the Midwest of my position to the CDC. I ended up at the White House in the Eisenhower building the last week of February. And if you remember, the stock market had crashed 2 times. I found myself sitting in a room with the president's chief of staff, Mick Mulvaney, and some of the scientists who I've looked at up to my whole career. You know, the clues aren't what people say. It's the fact that they were literally shaking, some of them. So you knew the big one was coming. And everyone went around the room saying things about epidemiology and virology. And it got to me, and I don't know where it came from, but I just said something like, I really believe this is the higher angels moment. And people are really looking to the president. You know, this is the FDR Churchill. It is a war on a common enemy. It's like the worst science fiction nemesis you could make up. It's invisible. Like everything I'd fear about a virus came true bit by bit as we learned about it. But it's also, I used to say in my classes, what if we were being invaded from outer space by aliens? We'd all of a sudden in the whole world be on the same team. And this was that moment to lead. I got on an airplane, flew back, went to Metro Health in Cleveland with the governor to tour an infectious disease unit. And we came out. That was the first day we went to the media. And we said, you know, we're just going to tell you what we know as we know it. We don't have all the answers, but we will tell you everything. We, a big, again, serendipity, but we said at 2 p.m. every day, we'll gather on the Ohio News Network, who thought, like, nobody watches that, right? That's how I had to comfort myself. And we will keep telling you what we know. That was the weekend of the Arnold Classic decision. So we realized that mass gatherings, big risk in the playbook, and we were going to have 80 countries, 250,000 spectators. I already had heard underground that at the Biogen conference in Boston, 2 people had walked in, 70 people went out sick. Ambulances were pulling up at all the hotels. So it was a bold policy move, $50 million lost to the economy. Really amazing. Our local health director's there, the mayor of Columbus. But that's when I think the rest of Ohio woke up to what was happening.
And Jim, for you, how did you at the local level think about what your response was, and how did you what were your priorities?
Well, I think as Dr. Acton said, we tuned in every single call we could. We had gotten to know Dr. Acton, we knew her team, and we knew that they were going to be honest with us, which was important. Because as she said, there was so much what's going on, and they told us what they knew, but they didn't try to speculate and tell us what they didn't, which was important. So from our standpoint, we mimicked actually what they did. We held press conferences locally to try and get the word out to tell people what we did know, because we thought it was important that they were hearing that locally. As Dr. Acton said, I don't know how many people watch the Ohio News Network in Williams County, but it's probably not real high. So we wanted to utilize our local media, and we did. We sought out, every avenue we could. We met periodically each week with our providers, and then calls in between just to let them know this is what we know, that what's going on with you, those types of things. And I think an important point that I hope we don't lose is, as she talked about the Arnold event, it's really difficult to understand, but so many lives got saved by actions that were done. And it's hard to show that to people, and they have a difficult time with that. But I think that it's very important. We talk about this a lot, that from this standpoint. We need to recognize how many people, how many lives were saved. At that time, New York, we were still learning so much. And those actions that the governor did at that time saved Ohio's hospitals.
I'm curious, at a very practical level, for each of you, what were some of those kind of collaborations and coordinations that you were like? Who were the other organizations, bodies, government officials, school districts that you were interacting with in your role? So, Dr. Acton, for you, kind of who were the key parts of, the response outside of public health that were part of your day-to-day or week-to-week in those months of the pandemic?
That's a great question, because a big thing about public health is that it's about convening. It's about being a chief health strategist and convening systems around a table. So even before that Arnold Classic decision, we had been meeting with all the hospital associations and nursing homes. And, obviously all of the cabinet was involved. So you had prisons and aging, and we were already thinking about who would be the high-risk groups. We met with all the superintendents of schools. As a matter of fact, our first cases of persons under investigation were at Miami University. So as you can imagine, I flew there and we had a huge press conference at that time. What folks saw, first of all, I want to say about the press conferences, they, by accident, stumbling into that 2 p.m., became, one Kenyan professor studied 7 weeks of press conferences and said that became a ritualized holding space, which I was just on a conference with the National Academy of Sciences looking at communication. But we learn crisis communication, which are these C's. You want to be clear, concise, consistent, credible. But the level of communication needed, I literally remember driving to the State House one day with all the traffic going in downtown Columbus, knowing that it was going to look like the streets of Wuhan in 2 weeks. And what are the words that you use to make meaning or sense of that to people? And so those press conferences, again, even the media would be there in the beginning, and we were all going through the same thing. The media had parents. So those press conferences became a place where everyone in the state could come and hear the same information at the same time. So that was another way that we kept all the players informed. Behind the scenes, it was a war. People don't understand there were hunger games for PPE where literally our hospitals were outbidding each other. That was, so I was solving problems with my team, and I'm sure at the local level, that you have never had to solve before. The beauty of that is that people started talking to each other. There's always opportunity in crisis. And I'm telling you, the things you bureaucratically can never solve, we were solving in a day. So now hospital CEOs, we created a whole new zone system. I'd have to figure out how to move a ventilator from a vet office to the Cleveland Clinic. So we created these whole new triage systems, and people don't want to dismantle them. Hospital CEOs talk to nursing home leaders, talk to prison wardens, talk to school superintendents. And that, to me, could be a big pearl going forward, because as we know, our health is affected by all these things. We don't live in a bubble. All these things are affecting our health. So these relationships of chief health strategists is, I think, the future of modernizing public health.
And for you, Jim, what did that coordination look like? What were the bodies and individuals, and, what were your key priorities for coordination?
So I think the first thing that we went to, I think, was that thinking of, okay, let's get our medical providers, our hospitals, our nursing homes together. But it's really more than that. And so, you turned this outside of public health. Well, there isn't an outside of public health. I think one of the things that we really strive to do is making sure that we were thinking about who else needs to understand that you're part of public health. So like our industries, once we got to the point of reopening industries, how do they do that safely? And how do they need to think about employees that are calling in, following the guidance in regards to testing and all of those types of things. So that was important for us to really try to get more and more people together to understand that. I can remember back early that talking with a township trustee when things really started to head south with cases, and he said that he remembers we had a meeting with a bunch of township trustees, and he said that I knew when you spoke in March to our group that you were scared. And that resonated with him. And so they got it. At least a good portion of the population, I think, understood that this was serious. And so I think trying to think about getting people, and I hope, as Dr. Acton has said, that I hope that out of this, people understand that all of these are part of public health. There's no separation because we're all a community.
And I just want to add that these policies, every single one we saw, were so hard got. We worked literally since January of that year, 24/7. I mean, we could barely get the governor to eat. We were constantly bringing in experts. We were blessed that once we started telling the truth, a lot of scientists, many of whom had gone underground, started coming to us from all over the world. Governors started meeting with other governors behind the scenes. So we would be learning from, Governor Hogan and what he was hearing from his scientists and Charlie Baker, and people were reaching across the aisle. It was a blessed moment where all of the rhetoric and politics just fell away. Nobody wanted their people to die. And this typically is run at a central level by the federal government. So all of a sudden, you have all these governors solving these problems for the first time. So, mandates, people talk a lot about that. What the pandemic playbook that George W. Bush created was an emergency brake. Like, we were really trying to slow everything down, stop the logarithmic spread of this disease so we could learn how to treat it. The mortality rate, now when they look back in March, if you got in the hospital in the ICU, was 25%. By June, it was 5%. So we had to teach doctors and learn what worked and what medicines we could use or how to lay a patient. And so all of these things, though, they always knew they'd have cascading consequences. So once you make one policy decision, you had 20 new ones to make. And you can't legislate your way out of this. And this is the most important thing I hope people in Ohio know. Ohioans saved lives. Ohioans flattened the curve. They did the actions. They did those Swiss cheese efforts. There is no amount of rules or regulations you could put in place. What we really had to do was if enough of us did the right thing, most of the time, all of us would get through. And I have to say, it was an amazing thing to witness, Ohioans.
My next question was about kind of areas where the state's COVID response really excelled. And I think that's what you're hitting on, right? Some of that coordination, as well as that kind of interstate connections. Anything you want to add, Jim, about things that you think did go really well, especially from your perspective at the local level?
Well, and I think from the local level, the response from the state, from the Ohio Department of Health, was just amazing from our standpoint. I will tell you that, they were on calls they were always there. So, I mean, it was 7 days a week. And I don't think people understand the amount of hours that, I'm going to throw this out here, but I guess from the standpoint, I get a little upset when people like to paint people a certain way, and government workers can be that way, that they are not hard workers. I got to tell you, there are some amazing people at the Ohio Department of Health. It was not uncommon to be on a conference call with them at 9 o'clock at night trying to figure out something. How's this going to roll out to the locals? Because they understood that just because they're talking about it in Columbus, how is this going to go for you folks? And how is this going to work? Is this really going to be the direction we go? And they got our input. And, I think it was a good relationship, and that continued all the way through. Even when the vaccine started to roll out, we were part of that. We were part of those discussions about who's going to get, from the standpoint, Dr. Acton talking about the Hunger Games. Once the vaccine was out, people were coming up with all kinds of reasons of why their group should be first. And that's a difficult decision to do, but it's something that has to be discussed, and we have to come to a conclusion. And we were part of that, and it was appreciated that that relationship was there.
Yeah, you're talking about real, multi-directional communication and coordination,
yes,
as opposed to a top-down, here's the decision, right? Because one of the things that I think is particularly challenging about Ohio as a state is This is a state that it is large, it is high in population, it is at parts very rural, at other parts very urban. The demographics vary dramatically depending on where you are in the state, to say nothing of the political, maps in the state. And so that kind of coordinated response is no small thing. It's one thing if you have a kind of small region that is quite homogeneous. Ohio is not that, right? And so that seems like a real achievement of the administration to try and bridge those differences through policy.
Well, and I think that's the thing. Just this morning, the governor had his call with health commissioners across Ohio, which have been regularly scheduled. The cadence is different than what it was a few weeks back, but he still does that. He still gets our input. He wants to know what's going on. And one of the things that we also get out of that, I would say, is that I hear from colleagues like Dr. Roberts in Columbus and her experiences. Her experiences are certainly different what we are experiencing. I hear some of the more rural than Williams County. There are a few, and their experiences, and those experiences are different from what we're going through. But it's an opportunity to share ideas and to learn what's going on across the state, because it's good to have that perspective. So I can't say enough about the governor in regards to support of public health. He's been tremendous.
I want to ask a harder question, perhaps, which is, what are some of the areas where things didn't go as well, that maybe Ohio remains vulnerable if we see another surge in cases for this or for some other public health crisis in the future?
So everyone knew there was a pandemic playbook, and we prepared for pandemics, but there's nothing like the real thing to find out what works and doesn't. We have very old and underfunded data systems in Ohio. A lot was made out of some of the data calls I made. I have to say that's another area I'm actually proud of. But infrastructure like our disease reporting system are very, very old. It was actually hard to get money from the legislature because, of course, one of the biggest problems in public health is when you knock it out of the park and you're doing a great job, you don't see what goes wrong, and therefore you don't fund it. And so when you're not seeing the diseases we're preventing, it's a lot harder to get those budget items. And then going forward, we really need to modernize and have the state-of-the-art data systems and data analytics. We were fortunate. We partnered with universities around Ohio on a dime for some of the best minds. They ran models and numbers, as we now know. Again, when I was preventing it from happening, people were mad about the numbers I predicted because we weren't seeing them, which is the goal. I don't like being proven right, as we were by December of 2020, because that's not a good sign. But we also had data analytics from the Cleveland Clinic and other places. So that's another example, though, that isn't a government solution only. We were able to be agile on a dime and pull in, great expertise from business and logistics. We had a lot of partnerships with the National Guard. They were amazing to work with. So one of my biggest questions in public health is who's at the table. And you always have to think outside of the box. We all know, and I'm not sure if you want to go to this quite yet, but obviously, many, many people were hurting. These are hard decisions. And part of the playbook was a lot of wraparound services. So we were working behind the scenes. How do we keep small businesses going? How do we keep kids in school? Do we have to take them out? School closures are the last thing you do. So you only do that if it's a really dire circumstance. And how do you get them back as quickly as possible? Every industry, we were pulling in businesses to figure out how can you operate safely. And of course, we knew from the 1918 pandemic that there were anti-mask societies. One of the biggest issues with a virus like this, why it's a security risk, is that it's not just the virus that's contagious. There is a contagion far worse than the virus, and that is fear and disruption and hard time tolerating ambiguity that we all have. I have as well. And as you can see now, and you can see the signs of it still, we have 2.5 years now of being very untethered. And whenever your populace is losing a sense of control, it makes you much more vulnerable to bad actors, whether they be in our country or other countries. And we've seen all of that. That's what George Bush had realized. And so, much has been made of the vitriol and hate. And if I could just take a moment on that, I don't want to diminish that. I remember the day the governor asked me how I was going to do my Passover Seder. It was just a friendly question in a press conference, and I said something like, I make a mean bowl of matzo ball soup, I think was my answer, because it was Easter and Passover. My husband's Episcopal. We celebrate both holidays. And, it was within a day of that we had people pressed up against the State House glass wearing Guy Fawkes masks and with, machine guns. And I remember, there was a press conference going on live, and it was so loud, the screaming, and the panes of glass are so thin. And I was so shocked that people could be that like feet from the lieutenant governor. And I had to say and turn to the audience live and say, I know it's hard to hear me, but we have protesters. So when the first protesters started appearing at my house, as you can imagine, I live in a very normal house in a very normal neighborhood. So this is not, ultimately I had executive protection, which is very unusual. We had 24/7 state highway patrol in our driveway. And there were people protesting that I wanted to go outside and talk to, because I wanted to hear what was happening. I wanted to hear from a small business owner. But when someone is standing next to them with hugely anti-Semitic statements and guns, you can't. And that's the sad part about this is it got in the way of conversations. I can tell you there was a turning point. It was April 17th when the President of the United States said activate and liberate in tweets. And the people... I found out later that there was a safe house for my family. My kids of mine that live in California were being stalked at their workplace. All of this was very coordinated. I was seeing it in other states with my colleagues. They were saying the same language and the same things were happening to them. So this was a very organized group. And it turns out these groups are the same people who were at January 6th. So, one of the sadnesses for me is that I want Ohioans to know 70% of people were all rowing in the direction. My house is full of letters, including from legislators. I would get flowers even as they were doing certain antics in the State House. There was so much more love than hate. And that, I can return to in a little bit, is a story I'd like to tell about Ohio. But Jim,
in terms of, I want to touch on two things here, but in terms of kind of worries you have, again, thinking at the local level, where would you like to see more attention given, unfortunately, if there's another round or a new public health crisis that we need to deal with?
So I'm going to echo Dr. Acton. Data failure in Ohio is bad. I think about from the standpoint of being able to get information was very difficult, and on the local level, it's a nightmare. The systems are extremely antiquated. We've just passed on a national level the infrastructure bill because we're worried about our bridges and roads. It's the same thing. We need to start investing in these types of things because it saves money in the long run and actually saves a lot of lives. We could have done a better job had we had that, but we did not. And so I think if there's anything that needs to happen in the state of Ohio is that we need to reinvest in technology. This is not 1995. We need to move forward. I think at the local level for us, that caused us to put in more time and more hours because these data systems fail. And then, that's where you can make some savings, and it would be very helpful for the state of Ohio. I think the naivety that Dr. Acton talked about, I had a conversation with her the other day talking about, we had just had our 100th anniversary as a health district from 1919 to 2019. We had that, and just reading that, and as she talks about, there were all kinds of statements being made at that time, anti-mask, miracle cures, people that didn't believe it, and we thought, or at least I thought, wow. Boy, it's sure great that we have so much better science knowledge than what they did then. And I was very naive into what we were getting into, because that's where we found ourselves, is back at that point where we've dealt with some other emergencies in the past, like H1N1, things like that. And it's like, okay, so having been around a long time, I was saying to my younger staff, oh yeah, this is how it works. We'll get through this. And I had no idea. I honestly have to say that when you get into a pandemic like that, we were not prepared.
The playbook can only tell you so much, right? And then you're inventing everything else.
Yeah. I think the playbook can give you structural things to do, but it's just like we've talked about, like with our vaccination clinics. Perfect. We went through that. We knew how to do that. Very, very simple. It was the other pieces that we just did not appreciate.
I want to return to kind of the issue of some of that harassment and sort of the organized campaigns against mitigation efforts. A recent study by Johns Hopkins University found that of 583 surveyed health departments, 57% reported episodes of targeting that included personal threats, doxing, vandalism, and other forms of harassment. And that's precisely, kind of what you experienced, Amy. We also know that women in those positions received an even higher percentage of that kind of targeted harassment. And you've mentioned kind of the anti-Semitic threats. So you throw in other, marginalized dimensions of identity, and that harassment gets even bigger. But in addition to those things, that study also found that rural health officials faced challenges of being the local representative for health policies that were often set, at state or national levels without having as much of maybe support or infrastructure to roll with the punches of that harassment. Less sort of, folks to come in and maybe provide the safe houses or the armed guards and things like that. Could you tell us a little bit about your experience of harassment or some of that resistance as a local official?
Well, sure. I think one of the major differences, I think, in a local situation is that because of the size of the population, you're never anonymous. The park I live next to, walking my dog, anyone I would see, it was always about COVID or things of that nature. Going into restaurants, getting looks.
Amy, you're nodding that you also were not anonymous. Yeah.
Yeah, there was just nowhere to hide. And I had one of my staff members talk about that, and she actually works in our county, lives in an adjoining county. And one of the moments for her had to do with going to the grocery store and going home to change her shirt, which had the health department logo, before she went in. And that was tough. Because, we knew we had supporters, as Dr. Acton has said, but we also had people that were not very pleased with us, and our staff was abused pretty heavily.
I have to say that one of the most heartbreaking things for me as a leader, and since when you have someone like Jim Watkins, who's a cherished community treasure, someone who's grown up in the community, has lived there his whole life, has all those rich relationships. These public servants gave everything. It's like they went to war, and it feels like one of those wars where people are mad at the people who are really trying to save them. And as we emerge from this, and we can talk a bit about that, we have a lot of healing to do. I can't say enough. Again, I had executive protection, just like you said, and this is why I was nodding. But his nurse didn't. And one of the saddest days was when I was talking to him on the phone, and he said, Amy, I feel like I can't protect my staff from what they're facing. We need to address that. These people are heroes. And before I'm done, we will be learning everything we can about this. We need a hot wash done at the state level to study what went right, what went wrong. That's always a part of every disaster response. We're fighting for that at the national level as well, a 9/11 style commission. We also need to come back and weave our relationships back, because these are our friends and family. These are your relatives who are nurses and frontline responders and health department employees. They're our friends and our family. And before I'm done, I hope in this state we memorialize this, because we have all lost so much. And we need to recognize these people for what they are. They're heroes who work tirelessly for Ohioans.
So as a follow-up to that, are there things that government officials or that others could do to better protect public officials from this abuse? Are there things that public health programs could or should do to prepare future public health leaders for some of these challenges? How would you respond to some of those questions?
To me, I think where we're at today as a society, I think that we need to recognize better to treat each other with more kindness in what we're doing. I think one of my favorite people I think about is Senator Claude Pepper, who was from Florida. And he never said anything bad about his opponent whenever he would run for office. He actually lost one time in the 1960s, and the reason why he lost was that he did not respond to his opponent when he was going around the community and saying that Claude Pepper had practiced celibacy before he was married. The locals didn't know what that meant, and he was soundly defeated. And I think when we need to recognize when people are not talking about ideas and policy, but abusing people. And I think that if our politicians could do a little more of that, that would be helpful to everyone.
Amy, do you have any kind of advice or what you would like to see maybe different to sort of help both protect public health officials, but maybe also change those conditions under which they have received so much abuse?
So there's no doubt we've been at war. We never named the war, but we are at war. You get to choose whether you're going to fight World War II or maybe it's going to look more like a Vietnam. But we've been at war with a common enemy, all of us and this virus. It's not us against each other. So it really takes, and unfortunately, the way things unfolded, we didn't have that narrative so clearly defined from the beginning. I think that would help. But as I said, people will intentionally take advantage of unrest in people. One of the interesting things for me was to watch other leaders, and particularly female leaders around the world. And Angela Merkel, I remember talking to the governor about this on a walk one day. She surrounded herself not just with virologists and epidemiologists, but with theologians and historians and social scientists, with military and logistics people. She really, again, who is at the table? So I think when we look back and study this, we'll realize that we needed psychologists and people who understand behavioral health. What we really needed, and again, in Ohio, for a brief period, we had this, was a narrative, someone to help us make meaning out of what is happening and the trauma that all of us have now gone through. And I would say we are in a new phase now where that would be we're in another phase. This might be the most important phase because this is a phase, if leaders so choose, can weave us back together again with the stories and narrative. And so having those other talents at the table will go a long way to thinking preventatively about this, just like everything else, not just the virus, but about who we are, how we feel. And the New York Times did an analysis in May 2020 of 60 days of our press conferences. And it was entitled The Leader We Wish We All Had. And they picked out themes. And I'd love to say we did this all intentionally. It was even linguistic style. They were like, she used this pronoun and I and you. And as you now know, I wasn't scripted, which is highly unusual, that I was allowed to just speak as a doctor, as a mom. But the qualities they said that we exhibited in Ohio in leadership, which was recognized around the world, was we owned it, first thing. We used brutal honesty. I believe in putting the cards on the table because that's where you can solve problems, but you got to just put it on the table. Vulnerability. We did give names to the things we were experiencing. Then also empowerment. One of the most important things our leaders can be doing is empowering. Again, a pandemic takes all of us being empowered to help your neighbor down the street and watch her children while she has the extra shift, to check on an older neighbor. All these things are ways we could preventatively enter this differently next time.
We're going to take a quick break. Thanks for listening to the Big Ideas podcast.
Question. Answer. Discussion.
If you are passionate about big ideas, consider sponsoring this program. To have your name or organization mentioned here, please contact us at ics@bgsu.edu.
Welcome back to the Big Ideas podcast. Today I'm talking with Dr. Amy Acton and Williams County Health Commissioner Jim Watkins about public health during and beyond COVID-19. We've talked about the vulnerabilities COVID revealed to our systems, including data and infrastructure, as well as sort of some of the social fabric. We've also seen the disproportionate rates of infection, serious illness, and death by certain populations, right? Black, Indigenous, Latinx, communities of color, as well as disabled and immunocompromised people. And we should also add that economic impacts of the virus have been uneven, right? How do you think public health policy can help address those impacts going forward?
So public health, as I said before, is really population health. It's all our health. About a third of the things that affect us are in our individual control, and we have to do our part on that. And a little bit of genetics and, our exercise and eating right. But 2/3 of the things that affect us are things that we can only solve collectively. And we always in public health through the ages have had a special extra mission, which was to watch out for those who might fall between the cracks for whatever reason. And as we know, even in emerging right now, we have to have so much grace and mercy because for some of us, we're not at risk. But if someone is wearing a mask now, they might be wearing it because their child is going through chemo or someone at home is immunocompromised. Public health for me, one of the things I'm most proud of is in our first budget, we created a new deputy director position to deal with what we call social determinants of health. Education, transportation, housing, all these things that disproportionately affect our well-being. And so we have that new deputy director, and she's amazing. And, in my career, I did work in places like Rwanda post-genocide and found that the infant mortality rate there was lower than it is 2 blocks from my house where I live in Columbus. How could that be? And they have so fewer resources. But they had designed a system of people from the community health workers who are given enough medical knowledge. They're trusted ambassadors of their community and embedded in the community. So they're actually getting, for far less resources, better health outcomes. So now we have programs all over Ohio where we are doing that same thing. So we're actually learning from countries that work with so much less. So these disparities, we see them everywhere. As Jim said, there's fabulous studies from the 70s and 80s. They looked at who dies. Sir Michael Mormont did this big study of who dies of heart attacks. And they assumed it was going to be the CEOs of companies because they're under the most stress. But what they learned at every gradient of the social hierarchy, that the CEO of the hospital actually lived the longest, and then the person who was like the lab manager lived less long on average, and that went all the way down, to the people who are doing the cleaning. And the thing is, how does our race, our stress, these disparities actually get under our skin? And we've learned so much fascinating research about how it's cortisol driven and how the wear and tear of the body of being in situations where you do not have control, where you are not empowered. So the dream of our world is not a scarcity resource mentality, but we all do better when all ships rise. So that's the thing, is how do we empower people and how do we create the conditions in which all of us can reach our full potential? And when we do that, we give our gifts to the world. So the world that I think we all want to live in is one where all of us can flourish.
So I just think from that standpoint, going forward, I think we need to kind of challenge our beliefs a little bit. I shared with Dr. Acton last night that I can recall when she got the job, and I told her last night, I said, yep, okay, another one of these physicians that's going to come in, be the director of health, and doesn't understand public health at all. And I've seen a few. But because she was genuine and she understood public health, as I said, when this all unfortunately came into the situation with the pandemic, I trusted her. I knew that she knew public health, and I knew she was going to do the right thing. And I think that somehow we need to start working to bridge these gaps to getting to know each other more. I think we're too separated when you talk about minority populations or lower income folks. I think that we have predisposed ideas, and I think we need to change that.
I think for me, I've had the experience of all the science, and I can look at all that. But when I grew up in Youngstown, Ohio, and, it's known that I had a pretty rough childhood. I was removed at the age of 12. But I remember learning about these social determinants by accident as a kid, because at my old schools, there were kids just as smart and just as nice, but their outcomes were so completely different. I get plucked out of it, almost like the random luck of the draw, go to a nice school, get a different education, get into medical school right out of high school. And, and it's not, it wasn't just that I worked hard or somehow did something right. And so to me, those are the disparities that aren't fair and aren't just, and we need to address.
Well, part of what you're talking about there is there's no such thing as a kind of like universal solution that doesn't, in fact, engage directly with those who are most disproportionately impacted, right? That you can't have a public health strategy that doesn't think about disability as a complicating factor. You can have an effective public health strategy that doesn't address racial disparities and the impacts of racism on cortisol levels and or of trauma, right? And relative to your work, Jim, you can't have a public health policy that doesn't address environmental issues and the way the environment impacts our health.
Well, and I think that's the thing is that in a really want to hit this point hard. When we talk about public health strategies and bridging these gaps between communities, this is going to take the whole society. That's not just your local public health department. That's not, members of the community in the medical community or social services or what have you. This is where we really need members of industry to go and learn and understand. One of the things I see a lot of times, you'll see police officers interacting with disadvantaged youth, and it's always talked about it as in a one-way kind of concept. I always really bothers me. It's like, well, they get to see that the cops aren't bad. Well, no, the cops also need to see that the kids aren't bad. And so I think that that's what we need to get to. And it really, if there's anything that comes out of this, I hope that we can move to something like that, to where we really start having those kinds of conversations. Dr. Acton and I talked last night a little bit that one of the problems that upset our staff on a call early this year was some strategies to try and not have COVID spread within the home. They're all predicated on that somebody lives in a large home where there's more than one bathroom, where they can separate. And we didn't consider those things very well. The unfortunate thing, too, and I think what was done originally right, was some of our people in retail or food service who needed that paycheck. Unfortunately, those types of things have gone away. So to get people to actually quarantine, isolate, whatever, it's going to be very difficult with that. We need to understand that there are risks when you make those decisions, and we all need to get a better understanding.
Some of the work I've done in my career has been around kindness, and I always say that kindness isn't a science-based and research concept. It's an age-old, enduring, every religion, every society. It's not niceness. Niceness is when we pretend and say something to you and go behind your back. Kindness is the dignity, human dignity, and seeing it in one another. I talked earlier about the hate, but I've got to tell you, I witnessed, I think we all, if we were alive, we remember after 9/11, there were these couple of days where everything fell away in the world and there wasn't a stranger on the street. I swear to you, this went on in Ohio for at least a good 6 weeks, so even longer. My house, our mailrooms, which are bigger than this giant room we're sitting in right now, the governor and I filled up with things Ohioans made and sent. I talked about making meaning. People used art a lot to try to get through it. I remember trying to use a metaphor of 6 degrees of Kevin Bacon spread, and there's a giant bacon statue in a corporate park in Cincinnati somewhere I hear. The letters I received from Ohioans were of every age, rural and urban, every party, everyone on the spectrum. And that's a big thing about power differentials. So this is about empowering people. It happens in bullying. It happens in domestic violence. It happens in world order. And the truth is, most of us, the bystanders, it's our voices that need to be heard. You want to use human-centric design. So whatever you're designing, that you want the people that most use it or need it to be at the table with you. But I can tell you, I really do think most people are craving decency, and we need leaders who set that table so we can come to it, have the hard conversations. It's kind to have the hard conversations, but it is out of that shared wish for all of us to live a good life. And I think that's most Ohioans.
Thank you so much for joining me today, Amy and Jim. This was a real pleasure. Listeners can keep up with ICS happenings by following us on Twitter and Instagram at ICS BGSU and on our Facebook page. You can listen to Big Ideas wherever you find your favorite podcasts. Please subscribe and rate us on your preferred platform. For more information or to suggest a topic for a future episode, visit bgsu.edu/BG Ideas. Our producers are Chris Cavera and Marco Mendoza. Sound engineering today was provided by Deanna McKeegan and Marco Mendoza. This episode was researched and written by Carrie Hanlon.